Now I'm trying to look at the last type of what? Atrioventricular block. This is a third degree. We spoke about the first degree. We spoke about the second degree having two subtypes. That's morbid type 1 and morbid type 2, right? So here now we'll be looking at the third degree of atrioventricular block. Okay, and you know that in medicine, when they are talking about degrees or grading of something, as we are going up, the worse the condition is becoming. Okay, so looking at this now, the third degree of atrioventricular block. Now, for the third degree of atrioventricular block, you simply know that what? There is a block that is so severe that the atria and ventricles are now depolarizing independently. So there's no association between the atria and the ventricles. The atria are doing that thing, the ventricles are doing that thing. Okay? So this is also called a complete AV block. Like there's a complete block, right? Or a complete heart block. All right. So AV conduction fails completely, and the atria and ventricles beat independently. That's there's a dissociation between the AV. Okay. So ventricular activity is maintained by an escape rhythm which arises in the AV node and the bundle of His, also known as a narrow complex, right? Or the distal Purkinje fibers can also be developing some escape rhythm. Okay, so that's the only thing that is maintaining the ventricular activity. The atrials are no longer passing impulses to the ventricles. Okay, so a complete heart block produces a very slow. If you take the pulse of the patient, this is how I was saying pulse should be between 60 to 100 beats per minute. If you take the pulse of this patient, you'll be having about 25 to 50 beats per minute. Okay, and yeah, the pulse will be regular. All right, except in the case of congenital complete AV block, it does not vary with exercise. Okay, so Canon waves may be present in the JVP. Intensity of S1 varies due to what? AV asynchrony. So if you look at the intensity of the S1 sound, okay, that's first sound, okay, to be varying because the atria and the ventricles are no longer synchronizing. All right, so I think that's it for the third degree atrioventricular block. Right, wasn't actually much talk, right? Just for you to know that this one is like the end stage of atrioventricular block. Right, it's a complete block and there's possibility of a heart failure arising.